Welcome everyone. My name is Dr. David Amron. This is Lippy Logic. I'm the host of the show, and welcome to the Lippy Lounge. Today's segment is about what is different about lipedema liposuction surgery. It's a question I get asked a lot from patients, and I think it's a very good question. What is really different about this surgery that's just not cosmetic liposuction? And we're going to talk about all these different elements of things. But I'm going to start by saying that this is not beginner liposuction. It really is not. It is one of the most difficult, complicated forms of liposuction surgery, and I do every aspect of things. Cosmetic liposuction, very in-shape patients, a lot of complicated revision stuff, complicated areas, and lipedema is the majority of my practice, which I've dedicated my practice to, but it is very difficult liposuction surgery. If a surgeon calls himself or herself a lipedema surgeon, they really need to really commit to this and not just take it on as part of their practice, because there's so many components to it. There's so many unique aspects to it. You're dealing with very complicated patients. You've got to be able to handle the gamut of patients from stage 0, stage 1 patients that are primarily looking for cosmetic improvement that you want to nail, to stage 4 lipolymphedema patients that may weigh 500 pounds that can't walk, that have extensive fibrosis that you need to know how to handle. It's not just your average patient. You have to cover the gamut of even the extremes of it. There's also a lot of other considerations, pre-care, post-care, that are very specific to lipedema patients. I've trained surgeons from around the world in my unique way of doing this. I've had surgeons from England, from Morocco, from South America, Colombia, and a couple surgeons from the United States. It is something that I will say you really can't just learn in a day or even a week. It's not just something that can be shown to somebody and just start to do it. It takes a lot of time to get the skills down, the understanding of things. My current fellow, Dr. Arya Vazurnia, we have spent the greater part of a year going through every part of things and the training of the way in which I go about doing the surgery, from certainly technically every component of the markings, the incision points, all these things we talked about, safe plane, the proper approach, certainly all the skills of the sculpting, the way I go about doing it, all the tools and techniques, the treatment plan, how you're grouping things, the proper pre-care, the proper post-care, the intervals. All these aspects go into the proper training of a lipedema surgeon. Let's take a look at the different components of why lipedema surgery is different than just regular cosmetic liposuction surgery. So area number one to understand is lipedema is a disease. The treatment must be done with the disease in mind rather than just only cosmetic improvement. It is a disease, lipedema. Number two, these are very complicated areas. And this is why lipedema surgery has been avoided by most surgeons when it's involving areas like calves and ankles and forearms. In my extensive experience with this, I'll tell you that probably only 5% at most of surgeons that do liposuction surgery do these complicated areas. Now you're starting to see more surgeons doing them, which I think is generally a good thing if they've been trained properly in terms of how to do them. But lipedema affects complex parts of the body that most surgeons will tend to avoid. Number three, the circumferential approach. Well, we've talked about this also. Lipedema is a circumferential disease. The lipedema fat wraps around the entire body part, which I call a cosmetic unit, making it necessary to approach the unit circumferentially as opposed to just simply in strips or debulking it. Number four, lipedema patients are susceptible to bruising. You tend to bruise more easily. That's one of the characteristic symptoms that go along with lipedema, or signs of lipedema. Since bruising is a prominent lipedema symptom, it is important to proceed with the increased risk for bleeding and bruising in mind. This gets into the whole thing about the proper preparation of the tissue. If you don't prepare it properly, you don't tumesce completely, patients will have more bleeding and more bruising, and more patients are going to be needing blood transfusions if it's not done properly. We've talked about this. The way in which I do it, preparation is a huge part of things. I create a bloodless field. I stay in a safe plane. Number five, patients with lipedema are susceptible to DVTs, which are deep vein thrombosis, which are clots in their legs. Many have hypercoagulable states with lipedema. Like I mentioned, lipedema patients are at increased risk, and they require perisurgical anticoagulation. And the surgeon needs to understand that. So as part of my protocol in every lipedema patient, they are on an anticoagulation protocol for several days after the surgery is done. So number 6, reduce skin elasticity. Well, we know this. Lipedema patients have hypermobile skin. They have hypermobile joints many times, but their skin is more movable. It is crucial to be mindful of lipedema patients' reduced skin elasticity due to coexisting Ehlers-Danlos syndrome. So you're dealing with a complex set of things, complicated areas, fibrosis, reduced skin elasticity, and knowing how to deal with all that and finesse that so you're getting the best improvement possible, and knowing again how to deal with reduced skin elasticity. The next one, lymphatic sparing. Well, you know, this term is thrown out a lot, lymphatic sparing. Of course you want to be lymphatic sparing, and even more so in lipedema patients or patients that have lipolymphedema. You've got to know where those deeper branches and trunks are. Staying in that safe plane is very important as the surgery is done to avoid any chance of damaging the deeper lymphatic branches and trunks. I've talked about this a lot in other segments. And finally, extensive fibrosis. Again, a huge topic, fibrosis. And one of the reasons why I said I wish we called this disease not just lipedema, but lipofibroedema. It's part of the story. It's a 3-part story: fat, lipo, edema, swelling, and fibrous tissue, the scarring that can occur. And the surgeon has to know how to deal with the fibrosis properly and completely, and the different patterns of fibrosis. I talked about this in a whole other segment about fibrosis. So that's hopefully a very good way of looking at why lipedema surgery is different than just regular cosmetic liposuction. I've talked about it in all these different categories and areas, and that gives you a good and complete understanding of this important topic. My name is Dr. David Amron. This is Lippy Logic at the Lippy Lounge. Thank you so much for tuning in.